So I nearly fell out of my chair the other day when I saw that Politifact, the fact-checking organization, had named as its lie of the year Obama's statement that if you like your health care plan, you can keep it. Now that decision by Politifact is one of the more ridiculous judgments that I've ever seen. And let me explain why. There are around 300 million people who are insured in the U.S. Around 3 million of those people got notices in the mail saying your insurance plan no longer complies with the standards of the Affordable Care Act. So right now we're talking about 1% of the universe of insured people. Of that 3 million people who got notices, a sizable number of them will soon go to either their state or federal exchange and find that they got a sweeter deal going through the exchange than they had previously. And the reason that they'll get a sweeter deal is that many of them will be eligible for subsidies from the government. Those subsidies apply to everybody between 100% and 400% of the poverty line, which is a significant number of people who will get some sort of federal subsidy. Many others whose costs stay the same or even increase will still wind up with better, fuller, more reliable health care plans than they had before, and may be spared the indignity of getting sick and then realizing that their health care plan didn't cover what they thought it was going to cover. That's a good thing. Another thing to consider is that before the Affordable Care Act came into being, far more than 3 million people were receiving notices in the mail every year, turning their lives upside down and taking away their insurance. Prior to the Affordable Care Act, the notices said, we've discovered you have a pre-existing condition, you've reached your lifetime cap, we can no longer offer you any more benefits, or we can keep your plan, but we're going to have to charge you double the rate for the same plan because of your past usage of services. So this is an enormous improvement on the past. So what you have is a situation where Republican legislators will get in front of a camera and cry crocodile tears and say, I got 3 letters from constituents saying that they have to change their insurance. Oh my God, this is a catastrophe. Now, do you ever hear those same legislators getting in front of a camera and saying, my state, Texas, has 5 million people uninsured. If we expand Medicaid in my state, 1 million of those people tomorrow will have insurance. That is, I can knock off 20% of the uninsured in my state by simply expanding Medicaid. But I refuse to do that because I don't want to do anything that's going to help the president or help the Affordable Care Act succeed. So let's do everything we can to sabotage. There are around 45 million people without insurance in the United States. If every state expanded Medicaid, about 17 million of those people would have health insurance. But you have, always in Republican states, governors who refuse to do that. Expanded Medicaid works this way. If you make 133% of the poverty level, that is, if you're a single individual and you make $15,000 a year or less, or if you're a family of 4 and you make $30,000 or less, you're eligible for expanded Medicaid, which would give you complete coverage. That would be an enormous benefit to people in places like Louisiana, Texas, Indiana, all of whom have enormous levels of uninsured. In Texas, below the age of 65, the percentage of people who are uninsured is 33%. 1 out of every 3 people is uninsured below the age of 65. And I'm using 65 because obviously people 65 and over are covered by another federal program, Medicare. But 1 out of every 3 people below 65 being uninsured is outrageous. And these governors are willing to cut off their noses to spite their face. And let me explain how they're doing that. Even though there are 5 million people who are uninsured in Texas, all those people get health care. They get health care too little, too late, when they wind up in emergency rooms long after they've gotten ill. We all know how terrible that circumstance is. Now, somebody has to pay for that care. So those hospitals provide medical service, and it's of course uncompensated. Prior to the Affordable Care Act, the government worked to subsidize that uncompensated care. It would make payouts to those hospitals. Now that the Affordable Care Act is in place, the government no longer subsidizes those hospitals. Why? Because it assumes that all those people now have Medicaid, that there won't be this influx of people demanding uncompensated care at the hospitals. But once the governor turns down expanded Medicaid, there's the same flow of indigent people going to these hospitals, but the hospital is no longer being subsidized by the government. So that money has to be paid for by somebody, and it gets paid for by the state. It gets paid for by the counties that those hospitals exist in. So when you turn down expanded Medicaid in your state, be it Louisiana or Texas or otherwise, you still have the same numbers of uninsured people. Those uninsured people still flock to the hospital when they need care. The hospital still cares for them. It's just that the state has to pick up a tab now without being helped by the government. Now, the government was trying to help these states by putting that same money into Medicaid expansion. But the governors, not wanting to help Obamacare succeed, turned down that option. I mean, it's a shocking situation that you would think the citizens of those states wouldn't tolerate for a minute. Now, these governors have to explain their behavior somehow. And so the rationale that they give is, we can't accept expanded Medicaid because it's simply too expensive. It'll bust our budget. This despite the fact that the government, the federal government, is picking up 100% of the tab for the next 3 years and 90% of the tab through 2022. So they're calling that a budget buster. Florida has 3 million uninsured. Texas has 5 million uninsured. Ohio has 2 million uninsured. Now, Ohio was an interesting case because Governor John Kasich, a Republican, actually decided to accept Medicaid expansion in his state. And as a result, he's become a bête noire in the Republican Party. He's a traitor. When John Kasich recently went on Fox News and was interviewed by conservative talker Laura Ingraham, she let the cat out of the bag. This isn't a budgetary issue at all. It's not a policy issue at all. It's, you're a traitor if you help the Obama administration. Here's what she said to Kasich, and I quote, "Governor, you guys are tight now. You guys are practically spooning, you and President Obama. I mean, gosh, that's amazing. Are you BFFs, best friends forever? For real?" She's teasing, yes, but the truth is plain to see. Republicans resent anybody that does anything that helps the Affordable Care Act, regardless of how beneficial it may be to their citizens. So the real outrage of Obamacare isn't about the 3 million people who got notices and could turn around and get new insurance and sometimes better insurance and aren't really any worse off than they were before. The outrage is the 6 million more people who could get insurance tomorrow or the next day if Republican governors would allow for expanded Medicaid in their states. So the lie of the year isn't, if you like your health care plan, you can keep it. The lie of the year is the collective plaint of Republican governors who claim, I can't accept expanded Medicaid. It's too expensive. Nonsense. Shame on Politifact, and shame on Rick Perry of Texas, and Bobby Jindal of Louisiana, and Rick Scott of Florida, and Nikki Haley of South Carolina, and Mike Pence of Indiana, and all the Republican governors who are actively involved right now in stiffing their own constituents. I'm Jeff Rowan. I'll see you next time.